Sometimes escapism is needed, right? When the world is really tough, reality slamming you left and right. And we're not saying escape from the reality, but sometimes it could be serving. At the same time, how would you teach people or tell people, how can we distinguish that, oh, am I escaping from the reality or am I just momentarily shutting my brain off? How would you be able to distinguish the difference?
We have so much jargon, right? We call it denial, resistance. So as trained professionals, we oftentimes get caught up in that. Well, sure, we have these big words to describe a very complex phenomenon. But I think on the day-to-day, it comes back down to self-compassion. So to be fair, I'm going to state my bias. I'm on this path of mindful self-compassion in the last 4 or 5 years. So introduced to the work of Kristen Neff and Chris Germer. So as a therapist, I learn about compassion, right? I learn about how we as therapists feel compassion for our clients, and we try to portray that. And that compassion is the gift of humanity, because I can't give you housing, but I can give you my compassion in being with you and recognize your suffering. So we're so good at learning that, but we forget that we can give as much as we want of compassion, but people need to learn their own self-compassion. They need to learn to give themselves that. So it's similar to sort of the Christian and the Bible notion of teach people to fish instead of giving them the fish, right? So that's great. That's nice from a therapeutic thing about, oh yes, let's teach people to have insight. But I think the self-compassion is the second level of insight. So I think in therapeutic work, there's 2 pieces. There's a cognitive piece, teaching people insight, which we're very good at with all of our cognitive behavioral therapy stuff. But I think the second piece of it is teaching people to give self-compassion. People are capable of compassion. Everybody's capable of compassion, because people who are really mean and angry, and whoever that is in your life that you experience as being mean and angry, right? But if they see some suffering somewhere that tugs at their heart, they will feel the compassion, right? So it's our job to pull out that compassion and say, you're capable of that. And now, how about we teach you to give that to yourself? The roundabout way to answer your question is, the self-compassion allow people to sit in that moment of pain. I feel pain right now, and I feel sorry for myself. You know how many people talk about, hey, let me wallow. I'm just wallowing in my loss and grief right now. Don't tell me to feel better, right? And that's it. Yeah. It's that moment where somebody is saying to you, I feel bad, and let me feel bad right now. Don't make me not feel bad. And that is the self-compassion, is soothing and saying, hey, I'm so sorry I feel bad for myself. And we as therapists need to learn to sit with that, because we're too easy to fix people. We want people to feel better quickly. And so we forget, we sometimes bypass that moment of allowing people to really feel angry and hurt and lost and sad and grief. Again, it's like reflection. Remember, so reflection is sort of the cognitive piece, right? This is the affective piece. Remember, people are only capable of small spurts of that. So start small. Even if it's just a quick 5 breaths of feeling sad. So what we do is we teach people to use that breath and say, okay, when you feel something, just do the 3 deep breaths and stay with that and see what it goes. And then if people want to escape it, okay, fine. 3 breaths is all you can handle. And then the 3 breaths become the 5. It becomes 5 minutes. And when people who do meditation or mindfulness work, they know that you sit with your discomfort, right? And so you teach people to sit with the pain 1 breath at a time. So we say, let's breathe through this. Breathe through the loss. Breathe through the pain.
Reminds me of like the ethos from James Clear's book, Atomic Habits. Like the whole book is about make 1%, 3% incremental gains. And it's all about progression, not perfection. I think the same philosophy applies here, where you don't have to aim for feeling the best, feeling the highs and peaches and rainbows when you're feeling low. It's like, no. Do 1% of breath work. Do 1% of maybe sulking less, or maybe even being more sulking in that moment if you're not used to being in the feelings or in your body, right? The somatic we talk about. I want to be more concrete for people because I think this is a really, really important topic. So, in this world where forgiveness and self-compassion are not rewarded, right? It's about, oh, don't think about it. Just move on. Just think you're through it. But there's a saying that you can't think through overthinking, right? So, like, how do you teach someone who don't have the professional training that we do, or who don't have any mindfulness practices that we do, and who want to be more self-compassionate, who want to extend more grace to themselves? How would you show someone how to do it, maybe on an incremental level?
Okay, that's a big one, Benoit. I think on the day-to-day, first, again, it's because it starts with noticing right here, right now, what do I feel? Am I angry? Am I hurt? Am I sad? So let's say if I work with a child, right? It's about teaching the child to have a word, to have a name to whatever they experience. And it has to be in their vocabulary. So this is where, again, cultural competence, right? Different languages that we work with. We don't work in English all the time. I work in Vietnamese half the time. So in Vietnamese or in your own language, what is it that's happening right now? And so this is where that mind-body connection comes in too. Sometimes, and I work with, say, folks who are very anxious, they can't tell you the feeling, but they can say, I can't breathe, or I have this block, or I have this tension on my shoulder. Okay, so let's stay there for a minute. There's that tension. Your poor body is hurting. Give it some soothing support. So we start with people naming what it is that they experience. I think naming the experience is a step towards coping with the experience. So we name what's going on for us. Don't even call it feelings, because people shy away from feelings. I don't have words for feelings. Just name what it is that you're experiencing, the pain, the whatever it is in your body or in your head or in your heart. Then from there, then we learn to sit with that and say, how do I soothe my shoulder? I don't have access to a massage right now, but how can I soothe my shoulder right now? I can at least unwind my shoulder. So then we teach people the next step. And this is where it's tailored. This is where the difficulties is. So you ask question about, let's make it concrete. The beauty is in the detail. It's you, Benoit, and you say to me, I have neck pain. Then you and I have to figure out what soothes the neck pain. For me, it's not the same as you. So you have to figure out, what do you want to do with that neck pain? And if you're ready to let go of that neck pain. And that brings us to stage of change, right? And this is one of the hardest thing, I think, for therapists to manage, is for therapists to sit with the discomfort of the client not ready to make the change at the level where the therapist wants.
Yeah, it's like because sometimes you have to let the clients go through the breakthrough and let them follow their own timelines, right?
Yeah. And so to come back to the concrete, so I know you're like, where are you going with the stage of change? To come back to your concrete question, again, if it's my cousin, right? My cousin has a lot of tension in the neck, but he's not wanting to deal with that because he doesn't want to connect that tension to relationship or whatever it is. So if I'm with my cousin, I can only help him notice that there's tension and figure out, well, does he want to feel less tension? And if he says, yeah, okay, how do I fix my shoulders? Then we can begin to start with the external. So sometimes our therapeutic work, we start from the outside in. A lot of people make the mistake of coming from the inside out. And in order to start from the inside out, you make people go inside and cut deep right away. It's too early. So for us, we start from the outside in. My cousin can figure out some fixes for the shoulders to start with, so that he goes, oh, it's a little bit better. Okay, so it's external, and then he's feeling a little bit better. And then we can then go to the next step of, why do you think you have tension? So remember, first we name the experience. We figure out if we want to do something about the experience. And if we do, then we begin to connect the cause of the experience. And also, what are some steps to reduce the discomfort? And then we take the next step, which is, do we want to do a little bit more fixing of the experience? Because sometimes it isn't about fixing the experience, right?
Yeah, I feel like that's really important. Yeah, sometimes you can't change their circumstances.
Yeah. And then sometimes it's about sitting with them. Folks who are incarcerated. Hey, I'm stuck in here. It sucks. So we can't fix it, but we have to learn to sit with, this is where I am. And one of the work that I came across again recently is Ram Dass' book on Still Here. So Ram Dass wrote a lot about mindfulness early on, and wrote about being here, right? Teaching us to be in the moment. So the book that I read in January was about his disability. So he had a severe life illness and is very incapacitated, really reduced capacity in terms of mobility, in terms of just severe disability. And it's all about being in the body, in his body, with all of these limitations. And really talk about being stuck, right? And I think in a mental capacity, in a mental health way, it's similar. That so many times we feel so stuck emotionally and mentally, similar to this physical stuckness and incapacitation. And so it really helped me in terms of perspective and learning, to think about what it feels like to be sitting here. And that comes with people with no resources, right? People with no housing, no finances, not having any family, not having any relationships, being incarcerated. I mean, name any of our population that we work with. There's that stuckness.